Well, thanks very much. And hi, everyone. I feel so much at home today and thinking of my NeuroDevNet days and now the Kids Brain Health Network. There is a saying that you can seek the wisdom of the ages, but always look at the world through the eyes of a child. There's also another saying that timing is everything in life. It is wonderful to share the same stage with Carla Qualtrough. I have known Minister Qualtrough, as my old boss, Jean Chrétien, would say, since a long time, long before she was an MP or minister. That's because Carla has been a partner and leader in the accessibility community since a long time. So when she asked me to sponsor in the Senate a couple of years ago the Accessible Canada Act, I was pleased to accept, not only because I believe in an accessible Canada, but also because I believe in Carla. Furthermore, I'm encouraged by her leadership and support for a national autism strategy since becoming minister. This is an important step forward. Every step is a good one. Teamwork has Canada on the right track towards a national autism strategy. And thank you for your leadership, Minister. Another important part of that team is Connie Putterman. There are so many people to talk about who will be speaking at this conference, but I thought I would give a shout out to Connie. She's a champion in the autism community and has been at this for over 20 years. Her dedication and perseverance are inspiring to me, and I know many of us are looking forward to listening and learning from her this week. The reason we are all here today is children. I've devoted my 17 years in the Senate to children. Now, I only have 8 months to go, so I have to retire according to the Constitution by the age of 75, but I must find more work to do, and I can look no further than former Senator Landon Pearson, who will soon turn 90, and I recognize I still have a future. But thank you, Kids Brain Health Network, for bringing us together this week so that we can work together for the inclusion of children living with neurodevelopmental disabilities in all aspects of Canadian society. We come together to find ways to improve their well-being, quality of life, and to measurably improve outcomes for them and their families. The work you are doing here is important. Work on evidence-based interventions, early identification, and enhanced family support. Now more than ever, it's time to put your findings into practice. Little history, 2007, a Senate report called Children, the Silent Citizens, which focused on Canada's commitment to children. The report identified many deficiencies in our system. Children's voices rarely inform government decisions, yet they are one of the groups most affected by government action or inaction. Children are not merely underrepresented, they are almost not represented at all. That is why your work, the Kids Brain Health Network, is so important. We must include the voices of children, including children with disabilities, in our policy making to give them a real chance to reach their full potential. It helps them to inform better government decisions and outcomes for our children. That brings me to today's reality check, COVID-19. Yes, it has a dramatic effect. The COVID-19, the pandemic, a dramatic effect on all of our routines. But this is especially true for children. The Kids Brain Health Network conference theme for this year, as you know, is fittingly new and emerging ways of connecting. 2020 has certainly made a shift the way we do business with our family, friends, sports, everything, and has raised many challenges in access to health, mental health, and many other services they rely on. Now, while the pandemic has created several barriers which need our attention, for example, basic service needs, I'd like to focus on something a bit more positive and challenging people with disabilities, children with disabilities, all of us are in this business together. I always like to look at the positive side of life. And that inspiration comes from a young man who works for me. My Senate office assistant, Michael Trink, lives with Down syndrome. And while we all miss our weekly lunch together and working time together, connecting remotely has helped him to gain new friends, stay healthier, and gaining a new expertise, all from his own Senate-approved computer. And Michael knows how to use new technology. Michael was born to Zoom or use any other new connecting technology. Programs and work meetings moving to online means a lot less planning for Michael. The shift means no travel time or arranging transportation. Michael has noticed that he is less tired at the end of the day. His immune system is healthier, so he gets sick less. Barriers to participating have come down for him as connecting online becomes more mainstream and accepted. Perhaps this is an unexpected advantage for people working with a disability. Furthermore, the positive effect has reached to Michael's personal life. He's made many new friends and acquaintances all during this pandemic, and he's been able to stay in touch with them as often as he likes without the hassles of finding transportation or becoming too exhausted. He's turned a challenging situation into a positive one, which isn't surprising knowing Michael and his optimistic nature. In closing, I finally want to give everyone a piece of advice from Michael, which has given me motivation to endure the stresses of the pandemic. I think it is good advice for all of us to use during this conference. In Michael's words, stay positive and keep moving forward. For all of us who are so engaged with the Kids Brain Health Network, stay positive and keep moving forward. Thank you.